So I've been asked to talk about compassion in health professions. So I've been asked to do this by Vishna because some years ago, we piloted the multiple mini interview at AMEA. So as part of that exercise, we asked our faculty to rank a series or list of attributes that we thought we were assessing in our selection interviews. So this was the list that we gave them, and there's a ranking. So surprisingly, looking at this list, compassion wasn't on this list. And I say surprising because almost universally, compassion is regarded as a virtue for clinical practice. So for example, the Medical Board of Australia considers that compassion, along with integrity, truthfulness, dependability, as a quality that a doctor should have. So not just in Australia, but in America, the American Dental Education Association also says that dentists should be acting for the benefit of the patients and the public we serve and approaching those served with compassion. The General Dental Council of the UK, again, you must treat patients with kindness and compassion. Everywhere you look, the Malaysian Medical Association also cites compassion as a necessary virtue. You go back to the UK and the GMC. In this report that was published in 2016 called Medical Professionalism Matters, it says that doctors should show compassion and empathy in their work, but there's some debate as to what is meant by compassion. Are there any limits to compassion? Is there a limit as to how much compassion we have and how can we express this? Is it possible to demonstrate and to measure consistently compassion in today's National Health Service? So I think it's fairly clear compassion is something that is very difficult to measure and very difficult to demonstrate. You know, some medical schools in the UK have actually attempted or are attempting to measure compassion in their multiple mini interview, with a station on compassion. And at least one interviewer has reported that within a station of 7 minutes, how could you tell, that somebody is compassionate? So compassion then is really difficult to measure, and I think it seems fairly clear and certain that in an interview of 7 minutes, you can't measure compassion, but I may be wrong. So what do we do? Are there any other ways of measuring compassion? So if you look in the literature, there are some questionnaires. So this one, for example, is called the self-compassion scale. So it's actually measuring self-compassion, but the premise is that self-compassion is almost synonymous to compassion for others. So if you can measure self-compassion, then you can actually assess that that person has compassion for others. So in this scale, for example, there are 6 domains to this scale: self-kindness, self-judgment, etc. And the person or the respondent is asked to rate some 26 items in this scale, how frequently they experience each of these items. So for example, one of the items is like, I'm disapproving and judgmental about my own flaws and inadequacies. Yeah, and so it goes on. There's a questionnaire you can use. This is another questionnaire. This is a 24-item questionnaire. So you can again ask respondents to rate these 24 items on a scale of almost never to almost always. And again, there are a few domains in this scale, ranging from kindness, mindfulness, common humanity, and so on. So apart from questionnaires and asking the sort of respondents or candidates themselves, you can ask your patients to rate how compassionate you are. So in this study, for example, they use a scale called the Physician Compassion Scale. Sorry, Physician Compassion Questionnaire. And in this study, they randomized 120 palliative care patients into two groups. In one group of 60 patients, the patients were asked to watch a video of a consultation between a patient and a doctor in a room. In another group, the patients were asked to watch a video of a consultation between a doctor and a patient, but there's a computer in that room. And then after watching the videos, the patients were asked to rate how compassionate the doctor in the video was. How warm, how cold, how pleasant, how unpleasant. So the results of this study show that the patients who watched the video of the consultation where there wasn't a computer thought that the doctors were more compassionate in that video. So this was quite interesting in the sense that by introducing some technology in the consultation space, that actually patients felt the doctor wasn't so compassionate. Okay, this is another example of a study where they asked patients to rate whether a doctor was compassionate or not. In this study, for example, they randomized cancer survivor patients and healthy patients into two groups. In one group, well, both groups actually watched a video of a consultation between a doctor and a patient. But in one group, which is the enhanced compassion group, there were two segments added to the video, one at the beginning and one at the end. So in the beginning segment, the first segment, the doctor says to the patient, I know this is a tough experience to go through, and I want you to know that I'm here with you. Some of the things that I say to you today may be difficult to understand, so I want you to feel comfortable in stopping me if something I say is confusing or doesn't make sense. We are here together, and we will go through this together. Then they watch the same video, and then at the end, there's another segment that the doctor says to the patient. And at the end of that, they ask the patients to rate the doctor in the videos and which doctor was more compassionate. So they found that the patients who watched the enhanced compassion video rated that doctor as more compassionate. Okay, so the researchers argued that it takes only 40 seconds to demonstrate compassion and to express concern for your patient. They also assess the patient's stress level using the state trait anxiety inventory. And they found that, again, the patients who watched the video with enhanced compassion rated that doctor as being more compassionate. So it takes 40 seconds to show compassion and to express the compassion through concern for your patients. But actually, in practice, what doctors are saying is that they don't have the time to be compassionate. There's not enough time to give patients the attention that they need. In the NHS, they say that with 10 minutes allocated to each patient, it's impossible to show compassion to their patients. And that publication, that study, also surveyed 1,000 NHS doctors. And of the respondents to the survey, over 44% of them believe that doctors are less compassionate today than 20 years ago. And this is not just one sort of report of this, some might say, crisis that we have in compassion. Another survey conducted in 2008 in the US amongst USA physicians also reported that some 42% of physicians said the professional morale of their colleagues is either poor or very low. So there's quite a lot of physicians and doctors. So some of the responses to this survey might have been influenced by the reports in some of the popular press about some scandals, that we've seen in some hospitals. And I'm taking this example from the UK NHS in Stafford Hospital. And this scandal, between 400 to 1,200 patients died as a result of poor care over 50 months, between 2005 and 2009. Patients were left sitting in their own urine and were forced to drink out of flower vases from lack of effectiveness in care. So this was a huge deal. So there was a public inquiry on that scandal, and that resulted in a Francis report in 2013. So some of the findings or conclusions from that report were morale was so low, and while many staff did their best in difficult circumstances, others showed a disturbing lack of compassion. And there were 290 recommendations in that report to address this. And the Prime Minister of the UK at the time, David Cameron, said nurses should be hired and promoted on the basis of having compassion as a vocation and not just academic qualification. So again, it highlights how important compassion is. But how do you do this? How do you measure compassion, so that you can actually reward people for this? And in most of our workplaces now, the measure tends to be how many bums you can get on the seats, or how many patients you can get in the beds, and rather than actually how compassionate you're treating your patients. So actually there's a really difficult issue about how to assess compassion, how to really recognize this. So it's becoming such a big issue. Some people say we have a crisis. Some people say there's compassion fatigue. And there are now even international conferences on compassion fatigue. So it's okay. So if we are to believe that actually we don't have time for compassion at the workplace, and that's actually quite a difficult thing to believe. Because if we believe that we don't have the time for compassion, then very likely we don't have the time for many of the things that we have to do, which means actually we are potentially putting our patients at risk, So, but anyway, assuming we don't have time for compassion, what this means is that we need a bigger workforce. We need more people in the workforce and the health workforce to do the things that we have to do so that there's time for compassion. But this is really unlikely to happen because in a number of countries, the population is aging. So where's the workforce going to come from? Yeah? Okay, because the populations of those aged 55 and over compared to those aged 25 to 55 is increasing. Yeah, so with the population aging and the working population shrinking, you are going to find it very difficult to replenish your health workforce with your population. Okay, you may say, well, there's a solution to this. Let's allow immigration from countries where you have, lots of young people, but they will have to climb a lot of walls to get there. So it's a real problem, yeah? Okay, so what do? We have a need apparently for more people in the health workforce, but we really can't get it from the population because they're aging. Well, there's this wonderful thing called the fourth revolution. There's a fourth revolution, and this revolution, there are four really main areas in this revolution. So these are the big data, artificial intelligence, robotics, and effective computing. Okay, so there are lots of things happening in these four main areas of the revolution. Okay, and according to the Susskind, who's written this book called The Future of the Professions, the revolution is going to affect the health workforce and also healthcare in two ways. One, it is going to replace or it's going to perform some of the tasks that traditionally are performed by health professionals. Yeah, so for example, you have systems now who can actually use the information you put in the system and then give you a diagnosis and tell you what condition you have. There are systems that can use big data to actually analyze your behaviors and then actually produce some sort of maybe health improvement plan tailored, to your behaviors. I mean, Google, for example, is able to identify geographical clusters, of the sort of search people make. So for example, when people are searching for answers to their symptoms of flu, they can almost quite accurately predict that in this area where people are searching about flu symptoms, there will be an outbreak of flu. So they can do this a lot more quicker now than we have been in the past. So the revolution, the big data, and the AI is going to replace some of the functions that are traditional performed by professionals. The other effect it has on healthcare is in robotics and in effective computing. So this development in robotics and effective computing can have a direct effect or a direct impact on patient care. So, for example, I don't know if you come across Paro. Paro is a therapeutic robotic seal made in Japan, and it's been commercially available since 2004. And it can provide companionship, and some even say empathy, for the old people that have this robot. And some of these robots also have technology around sensing. They have the ability to hear through signal processing, to see through image processing, to touch, pressure processing. In short, machines like these can interact with the physical world. Then in effective computing, it is now possible for systems and computers to detect your facial muscle movements. Suppose by scanning your facial, what they call facial action units, they can distinguish a social smile from that is triggered by a spontaneous joy. And in differentiating between fake pain and genuine pain, they can determine if a patient is depressed. And by scanning a conversation between a woman and a child, some systems can actually determine whether this woman is the mother of the child. So the core of effective computing is to detect and express emotions. Imagine the day when systems can detect boredom, confusion. Imagine that I can tell straight away by looking at this computer here that you are really scared, that the revolution is here. Even perhaps, there may well be systems, that can actually detect expressions of compassion. And can this system be used in the selection of students for medical training, or students for any health professions training? Can this system be used to help us detect, in the context of a consultation with a patient, that the patient is not experiencing compassion from you? So, there are some who have gone even further, and some say that the day will come when there is culmination of the merger of our biological thinking and existence with our technology, resulting in a world that is still human, but that transcends our biological roots. There will be no distinction, post-singularity, between human and machine, nor between physical and virtual reality. In practical terms, human aging, illness will be reversed, pollution will be stopped, and so on. There may even come a day when we don't even need compassion, actually, if we are part machine and machines are part human, or compassion may take on a different form of expression. So, apparently this will happen in 2045. So get ready. Okay. So whilst we have the fourth revolution happening, going on, and all that happening, there's another revolution taking place. Okay, maybe not a revolution, maybe just a little movement. There's a movement taking place, and it is this movement to put hearts into healthcare. Yeah? This is a movement that is led by somebody called Robin Johnson, who is an anesthetist in New Zealand. So they have a website called Hearts in Healthcare, and in this website, they have quite a lot of resources in videos, podcasts. They have some training on how to be more compassionate. So it's a website that is probably well worth visiting if you're looking for some interventions to enhance your compassion. So, but actually, there is very little literature about what we can do to enhance compassion, especially in health profession students. There's some research about mindfulness training. We saw one about how to express or show concern for patients, but there is very little, and it's really, I think some people are debating as to whether it is possible to actually train people to be compassionate, So what do you do whilst this movement is, taking place and that revolution is revolting, revoluting, I'm not sure. Revolving, probably. So whilst all that is going on, I happened to come upon a mnemonic. A mnemonic is usually a word, but this is not really a word. It's just a series of letters from the alphabet. And it is something which, people in the movement are suggesting, proposing that we keep in mind to help us, to remind us, in our daily healthcare practice. So I think the first thing is that we need to all remember or remind ourselves that we're here as health professionals because we have some compassion to want to do something for those who suffer. So we need to remind, well, I hope that's the case. And we should remind ourselves of that. Sometimes you forget, don't you? Huh? Then we need to remember to treat our patients and everybody else with dignity. We need to remember to have equanimity. That means when things go wrong, you have to stay calm and carry on. We need to remember to be forgiving, but that doesn't mean to let go or to oversee something that, inappropriate that somebody might have done, but it's actually to address that and then to move on. Yeah. For G, we must remember to be grateful. Yeah, to have gratitude for being here. Yeah. To be humble, humility, that actually we don't always know everything, that there are other members in the team who can contribute something that you can't. We must always behave with integrity, always have social justice, ensuring that we take care of those who are less fortunate in society. And of course, we must always try to be kind, or at least remember to be kind. And finally, we need to find some capacity to love, yeah, to take care of each other, and that you may find helpful in your daily work, either with your patients or your students. And it's quite easy to remember. But if you can't find the capacity to love, then the thing to do would be to put oxytocin in the water so that we can all have oxytocin. Because apparently, people given oxytocin feel more intense emotions, communicate better during conflict, and smile more. I'm definitely getting some. Thank you very much.
Thank you, Alan. Looks like compassion is something that is, yeah, it could be something that is what we're now worried that is missing in our health profession, especially when there's a lot of publicity out there as to how our health professionals are lack of compassion, lack of empathy. And now the robots are coming. It looks like Allan is suggesting that robots are taking over the compassion part of what we're supposed to be doing. So now I would like to open the floor for this questions and maybe to start the discussion because we have about 15 minutes. Ron?
Have compassion.
A marvelous presentation to end this first day. Many, many thanks. I just wondered, do you distinguish between training a doctor to act compassion, adding these, I like that notion of the 40 seconds. If you say that at the beginning of the interview with the patient at the end, and you're trained to act compassion, you can demonstrate it, or the doctor who really is compassionate. Is there a difference between the doctor acting in a compassionate way, although they're really not a compassionate person, and yet, or is it that really want to train them to be compassionate? Is that a formulaic way? I think there's a big difference, and it's an issue.
No, I mean, I think, I think, I hope that actually we're all here as clinicians and health workers because we have some degree of compassion somewhere. I think it would be very difficult to come in, to even want to come in to be a doctor if you didn't have some degree. And I think sometimes maybe we forget, and I think by actually having those segments in the consultation sort of space, it's a reminder perhaps, so it's a reminder that actually, I need to express some concern for this patient. So yeah, I think that helps. Maybe that's the mechanism, why it sort of works. Unless, unless I mean, I think this morning we talked about selection, and I think you said that maybe we should be actually weeding out those that are not going to be good doctors, rather than looking for the doctors that are good, So hopefully our selection process is sort of robust enough that we are able to actually raise red flags, on those candidates or students that we don't think, that we think are going to be a sort of nightmare. And then hopefully the ones that are in, maybe we need to just remind each other that we are here because we have some compassion, and these segments in the video may serve as a reminder.
Thank you.
Right. Yeah, Hiroshi. Sorry, and then a gentleman at the back.
Hiroshi from Japan. Wonderful talk. Thank you very much. My question is about time. Recently, I read a book for my kids, which is titled Momo, the German novel whose name is Michael End wrote. And every time the revolution happens, the life is becoming more convenient, but seems like we are losing more time and people are getting busier and busier. And as you pointed out, if we lose more time, I have a kind of this sense of pessimism that we are less compassionate. That's my sense. So could I have your opinions about the concept of time and how it changes in this time of the fourth industrial revolution?
Sorry, can you
Yes.
just say the last bit again?
Yes. So basically, I think we are now living in a very convenient, more and more convenient society, but I feel that we are losing time. We are getting busier and busier. Yeah. So do you think that this fourth industrial revolution era, do you think that we are losing more time,
Yeah.
less compassionate, or if so, how can we do that? That's the question.
Okay, so yeah, so I think the general sort of perception is that, we don't have enough time. We're so busy, we're doing so much, and so on and so forth. So what the sort of proponents of the revolution are saying is that actually technology is not advancing so fast that actually we will have the technology to actually do quite a lot of the work, that we are doing now. So, the professions will change. So the diagnostics, will change, so people can go to a machine, put in their symptoms, and out come a diagnosis. So they won't have to actually go to a doctor for that anymore. So then it will free up the time for the doctor, hopefully, to just to spend with the patient. So that's how they see technology can.
But I also think that now we're living in the time to use Skype, web meetings.
Yes.
That theoretically it takes time,
Yes.
but we have more kind of meetings.
Yes.
Getting busier. That's my feeling.
Yeah, I mean, that's true. I think, I suppose, I don't know whether that's the issue of how we organize, how we work, how we organize the time, rather than necessarily, I really don't know if I have the answer for that. I mean, I think having sort of Skype and virtual meetings for us here in AMEA is quite helpful. Because, for example, some of our colleagues are in another campus, so we have meetings together. We do interviews over, for example, the sort of Skype as well. So it will save people from having to travel, to meetings and so on. So I'm not sure if I'm answering your question.
Yeah, I think I need more time to talk.
Yeah, I think the gentleman from first, and then Prof Lim, and yeah, the one at the back here. Would you like to use the mic? Can't hear you. We can't hear. Yeah.
The issue here, the compassion, I think it is the most recent and most important trend now in medical education. We are dividing. So this compassion is something abstract ability. We know the difference between a hostess smile and real compassionate smile. What is the difference? So I wonder to what extent actually we can change this abstract thing. I mean, a matter of attitude and behavior. It is one of the toughest job to change and in adult life. So to what extent we can change it in our higher institution level if someone is dividing already by birth and post-birth socio-cultural environment. That means I would emphasize more on selection process. If selection process is wrong, during a study at university level, it is very difficult job to change one's attitude and behavior. So I'm just asking Prof to comment on this. Thank you.
I think it's a really difficult one because I think obviously if we have a really robust selection, you're talking about selection of students to medical training, right? If we really have a very robust system of selection, then that would be great. But at the moment, the evidence will seem to suggest it's actually very difficult to select students based on compassion because actually, there's also a debate going on about how do we really measure it. So yeah, so it's really quite difficult. I'm not sure I can say, that we can actually, you can actually sort of identify whether people are compassionate or not just by having a conversation with them or asking them to do a test. But honestly, I'm not really an expert in this. I feel like a bit of an imposter. So if there's anybody who wants to help this gentleman out, please. Maybe this could be a really interesting research project for you. Can we assess compassion at the selection process?
Just a comment. I dread the day when we can measure compassion and then we put it to the test and we compare a robot speaking to a person and a doctor we have trained and we find that the robot wins.
And why would you dread that?
That the robot, because you say they are trained to be compassionate, that toy seal and so on, that in a situation of a robot programmed to be compassionate, it ends up the patients find that robot performs better than a doctor, a human being.
And is that so dreadful?
No, that means we humans are failing. But to his question, can we improve compassion in our training? I wonder if by getting our students to read books, take time off from all the science we have to do, and get them to some good pieces of literature, even watching some good movies and interacting with them and reflecting with them, we can improve compassion in our students.
See, I think this goes back to what Ron was saying. Those people who are likely to be compassionate, who have that interest, they're probably more likely to go and watch the movies. You can make them watch a movie, force them to watch a movie, but are they really going to benefit from it if they don't have that, whatever it is?
They will already be down that track. You don't have to push them there. Right?
Yes.
I think the gentleman at the back first. Sorry. Oh, yeah, okay. He's a true gentleman.
Okay, you've got 1 minute.
Ian Wilson from Australia. Just a brief comment about selection for compassion. it is difficult. We have experimented with different ways, but I'd like to take people back to 1944, I think it was, when there was a study, no, not a study, a committee met in London to make recommendations concerning the selection of medical students. And they listed off a whole lot of things they were looking for or things that they would do. But they also made the very strong point that we need very solid systems of getting rid of students who don't meet our criteria. So if they come into the system and don't have the compassion that we want, we need processes by which to remove them from medicine. And that was back in 1944. It was not something new. Thank you.
So, Stefan from Germany, I guess you know by now. Firstly, I'm very happy because I received an act of compassion just half an hour ago. The coffee machine here doesn't take any cards. I didn't have any money, and so I did ask the gentleman from northern Malaysia if he would make me a coffee for free, and he did.
Well, were
And
you
it was
suffering?
Very joyful and rewarding for both of us.
Were you suffering without the coffee?
I was suffering a little
Okay,
bit.
good.
So I think the point for reflection I want to offer is what's very interesting to me is how far our compassion stretches. We all are compassionate in ways, with our family, with our parents, hopefully, with our children. Then we have our coworkers, then we have our patients, then we have people who are part of a different political party, different ethnicity, people we disagree with, or people who go to prison for crimes. And, how far does our compassion stretch? And in terms of mindfulness, I think it's always interesting to sort of check in with ourselves. Are we genuinely compassionate, and how far does it stretch? On the other hand, the gentleman who gave me the coffee was very, very happy. And so I think also useful to remind ourselves that giving compassion is something incredibly rewarding. So actually kind of it makes sense to do it for ourselves. I do want to encourage, as many of you are medical professionals and involved in bringing students in and selection criteria, to emphasize it more. I'm very pleased that in a session about technology and evolution and everything else, we are talking about compassion, and hopefully AI will free up some space for more compassion. But also when you're selecting them, they're still young, so how do you reinforce it? So maybe Gabriel in Hong Kong, can put some more compassionate options on his list and maybe give them a little incentive to do that. Final point, I think it's good to have idols. Recently I was visited in Leipzig by the head of the Russian Medical Society, and he complained about a letter, like he wanted to see more ethics content. How many of you don't know Dr. Gaas or Dr. Haas? It's a Russian-German doctor. Anybody know about him? No? So he was a doctor in the 1850s who went to Russia, treated very privileged patients. This was after he had met a Russian of privilege in Germany. And in the evenings, he would go and treat people in old people's homes who didn't get very good care. Later in his life, he dedicated an entire 25 years of his life to treating prisoners by his own choice. And he made that his focus. Amongst other things, he invented the Haas shackles, and the Haas shackles were lighter, less metal, and had leather on the inside so that the prisoners wouldn't bleed. So as a doctor, 25 years of his life dedicated to humanizing the prison system, i.e. the people that tend to get the least compassion from many of us. So I think when you talk about these subjects, it's good to have an idol. So he's my idol. Maybe you guys have other idols you want to share about. I'm sure many of you do a lot of great good as doctors. So thank you.
Thank you.
Thank you. It's a good one. We can take one last question from Patrick.
So, I just want to share my thoughts on the comments given earlier, like about time for compassion. So I think, how about training our doctors to have the compassion to find time? If it's up in the priority list, then I think our doctors would be trained to really find time. And then as to teaching compassion, I don't remember anymore this movie, but in this movie, the professor actually asked the students to become patients in the hospital. So they had IV insertions, and they were wearing gowns. Their bottoms were showing, just like patients would in real life. So I think experiential learning is very important in developing compassion in our students. We are now, like in the conference, today there is a section for early clinical exposure, right? So I think if we do more of that one, we will be training our students to be compassionate as early as possible. And I just want to give a comment on the studies that you've shown. Some studies were on the selection process. Now, for me, it's quite premature to judge if a student has compassion or not during the selection process. I think the study should label them as having the potential to show compassion rather than never shows compassion or always shows compassion. Because as they develop, and with my experience in early clinical exposure, I learned that students would start with this attitude, but because of the experience, they would also change. So I think the potential to show compassion is not enough. We really have to see the students showing their compassion. Thank you.
Thank you. And
Thank you.
just to add to the list of training doctors to be compassionate, I think some of it has to do with role modeling. I think, students tend to sort of look at what their teachers or their supervisors are doing, and there's quite